Nurses in the capital are in danger.
There are firearms present, guns, bows and arrows.
That danger is not on the ward.
Some nurses have told me that they've pulled knives out of couches.
It's in the homes of Canberrans.
So we've had members who have had the front door opened and the patient or a family member may be holding a machete or a knife or an axe, a chain.
So far this year, there have been 4 assaults during home visits.
These are serious assaults that have occurred, serious enough to require medical assessment. We did offer occupational violence leave and that was certainly taken up.
I wasn't surprised, but obviously it's awful.
The nursing union says high-risk home visits aren't new.
Over many years, we have continued to raise safety concerns which lead to the risk of assaults.
Canberra Health Services says it acknowledges that problems have been raised in the past and that processes have been adjusted accordingly.
CPSU members at Canberra Health Services have been raising pretty serious safety concerns about home visits for more than 2 years now, in staff meetings, in union meetings, with management all the way up to executive level at CHS, and we weren't getting any traction until WorkSafe came in.
In March, Canberra Health Services, as required by law, reported these serious assaults to the ACT's regulator, WorkSafe. In reviewing the incidents, it found
the situations resulted in physical and psychological harm to the affected workers and had serious potential to result in the death of a person.
As part of the assessment, WorkSafe issued 7 safety notices to Canberra Health Services related to home visit protocols. Among them, it found risk assessments used for home visits were ineffective and duress alarm systems carried by workers were unreliable and unsafe.
That's the finding of WorkSafe and we don't step away from that at all. We've taken that on board and that's why we've been working so closely with the regulator to improve our practices.
It shouldn't take a WorkSafe notice to get some action.
Last year, there were 43 instances of occupational violence on Canberra Health Services workers. 6 of those were assaults on nurses or allied health workers delivering care in the home. In March, Dave Peffer wrote to staff acknowledging and apologising for the 43 incidents in 2024.
Nurses and midwives, they don't want to hear apologies for it after the fact. They want to see some action. They want to know that their employer is going to do something to address the assaults in a timely manner.
Canberra Health Services has now completed the mandatory changes to its procedures issued by the regulator, including a review of the duress alert system used by workers.
We recognise that there are some changes that need to be made, but I would also note that our staff undertake about 120,000 home visits every year. The vast majority of those are, positive interactions with our community.
That's actually a really terrible way of looking at it, particularly when it comes to the safety of people's lives.
WorkSafe is now satisfied with the changes made by Canberra Health Services, with all 7 notices issued in March now being lifted.
Our members love the job they do. They care about going into the community and delivering really high quality healthcare services. We just want workers to be able to go and do their job and come home safely.
Care in the home, but at a cost. James Viver, ABC News, Canberra.